Hi, my name is Jørn Klungsøyr. I come from University of Bergen, Norway. I'm a researcher and a developer at the Center for International Health, and we're developing software for data collection, primarily targeted at low-income countries and rural settings. So we have a product or a solution called EpiHandy. EpiHandy is a product where you can design your questionnaires, no programming. You can collect your data using a mobile phone or a PDA or a handheld computer. And then you can export your data out and get it ready. No paper, no trouble of double data entry or anything. We've been working on this since 2001. We've had several versions. There's a lot of projects that have been using it, some for shorter periods of time, some for up to 4 years actually. We've now started a new phase of that project where we're collaborating much more internationally. So we're especially collaborating with Makerere University, that's in Uganda, where we have funding for about 10 developers and some master and PhD students over the next 3.5 years, where we're going to develop, I should say, a new platform for doing research that includes both the forms designer and data collection and so on that we had in EpiHandy earlier, but also adding the big component that's lacking for most solutions, and that's workflow. So workflow in the sense trying to mimic the paper. We have a paper. Paper is easy to hand over to another person, while an electronic version of a form is much more complex to handle, to cater for in a workflow environment. So we want to connect workflow and forms using mobile phones, web, desktop, handheld computers, or any type of electronic means that can avoid, so that you avoid using paper in your data collection. Specifically, we're working on doing this in a clinical trial so that you can test out a new medicine and you have a data system ready, set, go. The only thing you need to define is the questionnaires that you're going to do and the workflow, and then you have a system that complies to the international regulations on clinical trials, thereby ensuring that you can do a clinical trial at a much lower cost than you otherwise would do. And similarly, any type of study that deals with a follow-up or a cross-sectional study would be possible to do using that. The especially interesting thing about this is that it's a cross-country collaboration. It also involves other groups, and especially groups from the Open Rosa community. So we're very happy that we can leverage open source tools in this setting, and thereby hopefully being able to bring better and more affordable solutions for research and, I should say, any type of data collection and management in low resource settings. So check out EpiHandy in a couple of months.